The Democrats are back to talking about single payer as the answer to the nation's healthcare system. I can summarize the whole thing in one word: beware. It's a pile of false promises, and it's going to lead us to trouble. And, the most interesting thing about this is that they know this. They know that this is a bad idea. But again, this is about power. This is about making people dependent on government. This is not about finding a viable solution to healthcare. Case in point, watch Bernie Sanders in 1987. Have a look at this.
But I think what we understand is that unless we change the funding system and the control mechanisms in this country to do that, for example, if we expanded Medicaid to everybody, right, give everybody a Medicaid card, we would be spending such an astronomical sum of money that, we would bankrupt the nation.
We would bankrupt the nation. Yeah, Bernie Sanders knew it. He still knows it today. He knows that it's a bad idea. But let me take you back to the first part of his commentary. I'm going to play you the first few words just as a demonstration of how it is that the left promotes their deceitful messages. Listen to this.
One of the points that we understand, and I think was reinforced that when we went to Canada, is that, at least as I see it, and I'm not an expert on it, but this is the way I see it. Number one, you want to guarantee that all people have access to health care as you do in Canada.
Okay, you want to guarantee that everybody has access to health care in Canada. But the fact is, as Bernie Sanders well knows, and we're going to play to you how it is that he knows, Bernie Sanders well knows there isn't complete and unfettered access to health care in Canada. There's something called rationing. Now, rationing comes in many different forms. We've discussed this briefly before. The rationing that most people think about is this rationing where the government tells you, no, you cannot have your bypass surgery. Yeah, I'm sorry that you have a 90% block in your left anterior descending artery. That's an artery in your heart. I'm sorry that you have a 90% block in your left anterior descending artery, and we can foresee that this will probably cost you your life, but you're no use to society, so you're not eligible. That is like overt rationing. But there are many other different forms of rationing. One form of rationing is you just don't have the health care available, that type of care available. That happened in Canada. With whom? With Natasha Richardson. Do you remember who Natasha Richardson was? She was this beautiful actress. She was in many movies, starred in a lot of the movies of Disney, and she actually was married to Liam Neeson. Beautiful lady, wonderful actress, and she went skiing, if you recall. She went skiing. She hit her head on a rock. She got a headache. She showed up to the doctor, kind of walked away because she wasn't feeling too bad, gets a worsening headache, comes back, and they don't know what to do. Why don't they know what to do? Because clearly it looks like she has a significant closed head injury, but they don't know whether they should be opening up her skull to release the blood that had been accumulating in her cranium and squeezing her brain potentially to death, because they don't have a CT scan. That's an example of rationing. They don't have a CT scan. It's not that the government is turning you away. It's not that the government is telling you that you can't have this health care. It's that the government has made the conscious decision of not supplying the facility with the care that you need. It's as if the government were turning you away, and it's another form of rationing. A third form of rationing is undue wait times. When the government tells you, look, we're going to have a limited supply of X, say orthopedic surgeons. I'm one. So let's say that the government says, look, I know that we are best staffed at 1,000 orthopedic surgeons, but all we're going to do is we're going to provide you with 10. And yeah, you can get your orthopedic surgery if you need it, but you're going to have to wait a year and a half. That too is rationing. Those are all methods by which the system keeps you from accessing care. So rationing doesn't necessarily need to be this thing where the government overtly prohibits you from accessing the care. There can be other methods that essentially interfere with your ability to access that care. So when somebody like Bernie Sanders tells you, well, we really need to have universal access like they do in Canada, BS. They don't have universal access. to healthcare in Canada. Oh yeah, Canada may not prohibit it, and Canada may pay for everybody's insurance, but guess what? Just because you have a condition doesn't mean you get access in Canada. So whatever the solution is in Canada, that's probably not the correct solution. Let's move on.
Maybe you want to talk a little bit about that and why in Canada, under their national health system, you can have access for all people, and yet per capita, it is less expensive than in the United States.
Okay. The answer is very simple. The answer is because of rationing. That's what it's all about. In order for, if you want to have healthcare, if you want to have a system of healthcare, whether it's for you personally or a macroeconomics model where the healthcare is being delivered to the general population, it's going to cost you money. In order for you to pay less money for it, either you provide shoddy care or you provide less of it, and or you make it more difficult to access. That's the answer to his question. This was an interview that he was engaging in 1987, where for whatever reason he was asking this question. The question was a very simple one. The question was, why is it that in Canada the per capita cost of care is less than that in the United States? Now, we have a great answer for you. We have a direct answer for you. And the answer is responsiveness. That whole comment that you heard previously, this whole conversation that you heard from him about how if we expanded Medicaid and we changed the system and so forth, all of that was the predicate to a simple question. And the question again was, why is it less expensive in Canada? Well, it's less expensive in Canada because they ration the care. What they do is they ration you primarily in two ways. They primarily ration you by making you wait. There was a lecture that I was in Washington, D.C., where a Canadian physician was telling us about the rationing of care in Canada. He was telling us that people, by the time they gain access to a FEMPOP, a femoral popliteal bypass surgery, which is, for those of you who may have peripheral artery disease, you're aware. That's a surgery where the surgeon finds a vein and bypasses, or sometimes they can do it with artificial conduits, but essentially they bypass a block in the artery going down to your leg in order so that your leg gets better blood flow. It gets reperfused. That if it goes from the femoral artery, which is the big artery that's in your thigh, to the popliteal artery, which is right around your knee, if you're doing that, then it's called a FEMPOP bypass. He was talking about people waiting 10 to 11 months for a FEMPOP bypass. He was talking about people who had pain because their legs were getting such insufficient amount of blood that they had pain with ambulation, and yet they were still waiting 10 and 11 months. You know what was happening? They were getting an amputation. They were losing their legs. In the United States, you'd have it done within a week. Sometimes, when I've called for a general surgeon, I've called the general surgeon on the phone and asked him to see my patient. He'd do it within the next 2 days. That's how quickly you can get a FEMPOP bypass in the United States. We'll talk a little bit about total hips and total knees later on because there's a very compelling tape here for you to listen to. But this illustrates the point. If you're going to make somebody wait a year and a half to get the treatment that they need, by the time they try to get it, by the time their name comes up in the line, it's over. Whatever it is you're trying to prevent is over. Do you know there was a study that was done in an area in the mid-portion of Canada regarding the mid-central section of Canada? Do you know what the average wait time for complicated pregnancy care? In other words, you have a complicated pregnancy, baby's at risk. Do you know what the wait time was to get a complicated, high demand OB obstetrician to take care of you and your complicated pregnancy? 9.5 months. Okay. Let me explain this to you. The pregnancy only lasts 9 months, okay? So if the wait time is 9.5 months, you're done. It's over. Your baby will have died, and your pregnancy will have either succeeded or failed. It's over. So what happens? They come to the United States, where they can seek obstetrical help within a week or two. So look, this concept that the left continues to try to deliver to you, that somehow Canada has universal access? No, they don't. They don't. They just hide it better. They just hide it in a different way. So don't fall for this argument from the left, because this is exactly the argument that they're going to deliver to you as they try to fool you into believing that you should accept universal health care in our country. And yes, by the way, ruin everything. So anyway, what I was telling you a minute ago was about responsiveness. Okay, so here's an interesting thing. We talked about a few podcasts ago. We talked about how it was that that the United Nations had stopped ranking the world's healthcare systems because it didn't work. It didn't function. Okay, it was so flawed that they knew that they couldn't continue. Even the United Nations, even the World Health Organization, knew that it was too flawed for their own credibility. So they stopped doing it. But at that time they ranked the World Health Systems for the last time, which was 2000, they also did something called responsiveness index, a responsiveness index. Responsiveness index is how fast the healthcare system of a particular country was able to respond to a challenge on a patient. In other words, if you're doing great and nothing's happening to you, then you're not being measured on the responsiveness index. But if you get your heart attack, how quickly can the country, the healthcare system of that country, respond to that heart attack? How quickly can you get the care that you need for something when something goes wrong? In other words, where you're not completely healthy. You know what was the top one? The United States. The United States of America. Do you know what was the lowest one amongst developed nations? Greece. Do you know what the relationship was between the amount of money that the country spent per capita, the amount of money that each of one of us spent on healthcare per year, and the responsiveness index for that particular country? A straight line. Meaning, if you didn't spend for it, you were going to have a poor responsiveness by that country's healthcare system. If you spent for it, then you are going to have a great responsiveness. What we're paying for is responsiveness. And it's what we Americans, by common sense, call a great healthcare system. The great healthcare system of the United States is measured in the eyes of most Americans by the impression of how quickly can you treat me when I need you to help me. Yeah, I understand that you can give me free vaccines. I understand that you can give me a little brochure that tells me how to eat properly. I understand that Michelle Obama will take away the food from my kids. The question really is, if I get sick, how quickly can you get to me? Because otherwise, your healthcare system is worthless. The United States is top in the world. And if you correlate the amount of money that a country spends per capita on its healthcare relative to its responsiveness index, as measured by the United Nations, you get a direct line. For example, I told you Greece was the lowest. Greece spends $2,300 a year per capita on its healthcare, ranking the lowest with an index of 6. United Kingdom, $2,800 a year. Responsiveness index, 6.5. Switzerland, $4,200 a year. Responsiveness index, 7.4. The USA, our beloved United States of America, 6,800. It is the highest responsiveness. It is the highest amount paid per capita. Our responsiveness index is 8.2. Nobody comes close.